Hello, my name is Evelyn Fox, and I'm about to perform my uh, focused abdominal assessment. Um, my son will be helping me again. He'll be using the initials um, DJ as usual, and I'm going to obtain consent. Um, the video will be used for educational purposes only. It won't be available for everybody to see. Only my instructor will use it for grading purposes only. Is it okay if we proceed with the assessment?
Yeah, that's fine.
Okay. All right, let's get started. Well, hello, how are you?
Pretty good. How about you?
Okay, let's get started. I'm going to ask you to lift your shirt up to right underneath your chest at your nipple line. And I'm going to start my assessment. I'm going to look at your eyes. I'm looking at your sclera to see the color of them, to see if you have any yellowing. I'm looking at the general color of your skin. It's normal for your ethnicity. Looking for signs of jaundice. I'm looking at the contour of your belly. I'm going to get a view at eye level. It seems to be symmetric. As I'm viewing, I'm also observing to see if you have any movement, any peristalsis. I'm looking for any rippling. I'm looking for any striae. I'm looking for any visible masses, potential hernias in the umbilical area or abdominal area. I'm going to pull your pants down just a tiny bit. In your inguinal areas, which is common sometimes for young men, you know, you all like to do heavy lifting. I'm looking at your flank of your abdomen to see if there's any bulging, which would be indicative of ascites. Your belly's pretty flat, it's not protuberant, which would also be indicative of ascites. There's no bruising. I don't see any surgical scarring. Everything looks pretty normal. Have you experienced any tenderness?
No.
Okay, everything looks normal. So next, I'm going to move on to auscultation. I'm going to take a listen. I'm going to listen in a clockwise position with the diaphragm of my stethoscope. I'm listening for vowel sounds. A normal active abdomen should have 5 to 34 movements within a 5-minute period. Yours is pretty normal active. If it's greater than 34, that would be considered hyperactive. Less than 5 would be hypoactive. And of course, no movement would be absent vowel sounds. Sounds pretty good. I'm gonna listen with the bell. I'm gonna, in your upper right quadrant, along your subcostal or your rib line or your rib cage ends, I'm gonna take a listen here. I want you to take a deep breath in and let it out. I'm listening to see if I can auscultate any on the right side rubbing of the liver, and on the left side the spleen. You're negative for that. Now I'm going to listen to your arteries. I look first during my visualization. I didn't notice any bulging or pulsating here along your the midline. A few inches up from your umbilicus lies your aorta. I'm listening for any bruit or thrill. I'm going to listen with both sides. I don't hear any bruit. This will be, next I'm going to listen to the iliac bilaterally They branch off of the aorta and the hypogastric area. They feed down into the lower pelvic region on down to femoral. We're gonna go down a little further and listen to your femoral arteries that lie here. I won't be able to hear. Listen on both sides. The listening of these areas are listening for what we call bruit. Bruit is indicative of aneurysms, possibly aneurysms, or obstructions, abnormalities. Okay, we're done with listening. Now we're going to move on to palpating, or percussing, sorry. I'm going to percuss around the same way I listened and the same way that I'm going to put my finger here. I expect, as I go around, to hear tympani in every quadrant, which is the sound, sounds a little drum-like. Tympani, tympani, positive for tympani in all 4 quadrants. The sound will be different as I go up to your mid-clavicular area at your subcostal area, where I will percuss here, where the liver should be in this region. See, it's very dull as opposed to the tympani. I'm going to go over to the anterior maxillary area between the 9th and 10th. Let me count these. 9th and 10th intercostal space between the anterior. I'm going to tap from the anterior to the mid-axillary area to tap for the spleen on the left side. Dull. I mean, tympani, I'm sorry. Sounds just like tympani, which is normal. I'm also going to tap the bladder area. The bladder is flat. You did urinate, empty your bladder prior to. It's not distended. There's no tenderness here. If there was tenderness, it would be indicative of maybe a bladder infection. If it was distended, that would mean maybe if you didn't empty your bladder, you would have 400 or greater milliliters of urine there, or perhaps you would be suffering from BPH, which would cause you to have some urostasis or not complete emptying of your bladder, or maybe some urethral issues that doesn't allow the urine to completely empty. Tympani, exactly what we expect to hear, because that is an organ that's hollow. Hollow organs depict the sound of tympani, and solid ones are dull. Okay, next we're going to palpate. I'm going to start with a light palpitation. I'm going to go around like I did with all the other times. I'm going to go around in a clockwise, and I'm going to palpate lightly, about 1 centimeter down. Go on to the right upper. If anything is uncomfortable or tender, I'm palpating for masses or anything that's abnormal. No masses. And no tenderness. No signs of any enlarged vessels or small broken vessels. No signs of any bruising or anything like that. I'm going to palpate your liver. I'm going to put my fingers here. I gotta trace your costal edge. Okay. Place my fingers right here. And then I'm gonna ask you to take a deep breath. And then I'm going to palpate. Take a deep breath in. Hold it. Hold it, hold it. Okay. Just a tad bit, I can feel it. The edge of your liver. I'm palpating to see if the liver is enlarged. The liver should not be hyperextended from the coastal ridge. It should be no more than maybe a centimeter or two from the bottom of the last rib. I'm going over to the left side to perform, attempt to palpate anyway, the spleen. I'm gonna place my hand here, right at the 12th intercostal space. I'm gonna hold some pressure here. And I'm gonna do the same thing. Take a deep breath, hold it. I can't palpate anything there. That's normal. If I was able to palpate the spleen, it would be abnormal, indicative of a splenomegaly, megaly, or an inflamed spleen. The next thing I'll do will be my special test. I will first assess for, let's do the Murphy sign to test for cholecystitis. Cholecystitis is a gallbladder issue. I'm going to go midclavicular, a little bit below the line. I'll ask you to take a deep breath, and then I'm gonna rub the area. It's negative. If it was positive, you would be, I'm looking for grimacing, I'm looking for guarding, I'm looking for, you tensing up, because if you had issue with your gallbladder, it would be painful. The next thing I'm gonna do is assess for appendicitis at what is called the McBurney's point. The McBurney's point is located anterior superior iliac spine, and it's about 2 inches from there, and it makes you make a diagonal line in that position, which is about here. I'm going to apply pressure. When I apply pressure, if there was pain, that could be indicative of appendicitis. Also, when we did the deep palpitation, I'm going to go around in the circle and perform deep palpitation. The deep palpitation is performed with 2 hands, and it goes down about 3 to 5 centimeters. Let me know if I'm going a little too deep. I'm doing the same thing. I'm just assessing every area of the abdomen to see if there's anything abnormal. You don't have any ascites or anything on the sides. Go on over to the left upper quad. No tenderness. Assess the whole area. No bulging. Good. So, okay, we're done with the abdomen. I've done two of my special tests. I'm going to ask you to turn to your side. I'm going to do what we call a fluid wave test. I want you to turn on your right side. Just keep your legs straight. If this is a test that's performed, a test for ascites. We talked about ascites. I told you how ascites is fluid buildup on the stomach that would be indicative of a person that potentially has liver failure, secondary to cirrhosis most commonly. And because the fluid is dependent, when you're lying in a supine position, it naturally just goes to both sides. That's why I was looking to the sides. And likewise, when you turn on your right side, if you had ascites, the fluid would roll from your left side to your right side. So as I assessed, and there was tympany, if you had ascites, it would be dull in these areas because the fluid is there and the area is no longer air-filled. So because if you had dull before and on turning on your right side, if the sound is now tympany, that would be positive for ascites, which yours is not. So we're done with that. Okay, the last test that I'm going to do is, in my test that we did here, I'm not sure, I said I was testing for cholecystitis, but the name of the test is Murphy's, and the test here is McBurney's. That was the wave challenge. One more test. I'll ask you to sit straight up, and I'm going to step here behind you. I'm going to raise your shirt in the back so that I can see your back. Slide down a little bit. I'm gonna go down to your, this is a test. For me to see where your rib cage is, ends. Okay, I'm gonna place my hand here. This is called the CVA test, the costovertebral area that allows us to test for tenderness in the kidney area or renal area. I'm gonna put my hand here. I know it's a little cold, and I'm gonna tap firm but not painfully at this area. Any pain? I'm gonna do the same thing on the other side. Good. No pain is a negative test. That means you are negative for possible polynephritis or any kidney irritation, kidney stones, or anything that could potentially be wrong with your kidneys. That concludes our focused abdominal assessment, and thank you.